New Orleans is taking a new approach to emergency calls, making sure first responders are handling situations accordingly.
The city officially launched its new mobile crisis intervention unit, and Leah McNeil joins us in studio to explain how all of this works. Hey, Leah.
Hey there, Leslie and Eric. Well, we previewed this before, but now it's officially launched. The MCIU was designed to meet the mental health needs of our community, all while taking some of the burden off of NOPD officers. The work on this started before the COVID-19 pandemic. After years of work and a successful soft launch, the program is now a reality. It works just like 911, but instead of sending fire, EMS, or NOPD, if needed, they will send a licensed mental health professional and a crisis advocate to respond to non-violent mental health calls. They launched at the end of last week and say they have already seen a 36% decrease in the calls routed to NOPD for mental health calls. And so far, they have a dispatch time of 4 minutes. Dr. Jennifer Avegnos, the director of the New Orleans Health Department, says while this is a huge step, there are still gaps in mental health services sphere in our area that they are currently working to address.
And so we're not going to sit on our laurels and say, oh, great, we've solved everything. We know that we're filling a gap. Now we've got to turn our attention to some of the longer term needs of our mental health population, whether that's inpatient, outpatient, assistance with accessing treatment. And we're starting to do that with our partners across the city, but I think that's going to be our next area of focus.
The MCIU also works with the National Suicide Hotline to dispatch the MCIU with those calls as well. Right now, they are averaging between 7 to 8 calls a day, which is on par with years past. In the next half hour, you'll hear from the woman who's running the program. Leslie.